American Council on Exercise Personal Trainer Manual 5th edition, Chapter 8, Physiological Assessments by Kelly Spivey. Kelly Spivey, ND, has a doctorate in natural health and a master's degree in fitness management. She has an extensive career in the health and fitness arena, ranging from cardiopulmonary rehabilitation manager to owner-operator of 3 medically based fitness centers. Dr. Spivey is a territory manager for Free Motion Fitness, works with University of Tampa and the Health Science and Human Performance Department, and serves as a subject matter expert for ACE. She has authored chapters in both the Advanced Health and Fitness Specialist Manual and ACE Health Coach Manual. This chapter describes the various health and fitness-related assessments that are commonly used by personal trainers. The selected modalities follow the sequence outlined in the ACE Integrated Fitness Training Model. The personal trainer will select and administer tests according to each client's needs and desires using information obtained during the initial needs assessment. Testing methods are also determined by a number of other factors, including availability of equipment, time allotment, and the trainer's level of comfort with the assessment procedures. Chapter 7 introduced important foundational assessments: posture, movement, flexibility, balance, and core function that merit strong consideration given their contribution to movement. This chapter presents both health-related assessments and sports or skill-related assessments that are often relevant to program development and ongoing evaluation. Client goals and lifestyles will often determine the appropriate test selection. The health-related assessments focus on the following components: cardiorespiratory fitness, overall functioning of the heart and lungs, and the efficiency of the cardiovascular system in delivering oxygen to working muscles. Body composition in anthropometry, body composition and the distribution of body fat. Muscular endurance, the ability of muscle groups to sustain repeated activity and withstand fatigue. Muscular strength, the ability of muscle to overcome external resistance. Flexibility, the range of motion of a given joint or group of joints, or the level of tissue extensibility that a muscle group possesses. The skill-related assessments, excluding balance assessments, which are covered in Chapter 7, focus on the following components: anaerobic power, the amount of work performed in a given unit of time, usually represents one single and explosive bout, event, or repetition performed at maximal efforts. Anaerobic capacity, the ability to sustain high-intensity anaerobic activity. Speed, the rate of motion or the rate of change of distance. Agility, how accurately and rapidly a person can change direction, involves the stages of acceleration, stabilization, and deceleration. Reactivity, the rate at which an individual responds to a stimulus. Coordination, the ability of an individual to complete complex movements while providing an accurate response in both timing and intensity. Testing and measurement. The list of fitness assessment techniques presented in this section is by no means all-inclusive, as there are many assessments that can be used to measure physical fitness status. Some of these assessments are very simple to perform, while others are more complicated and require practice. It is important for personal trainers to act professionally and be competent when evaluating a client's level of fitness. There are a number of resources for gaining hands-on training in fitness assessments, including the following: ACE-sponsored workshops, local colleges or universities with exercise science departments, experienced personal trainers, athletic trainers, or rehabilitation specialists, repeated practice using friends, family members, or other trainers until comfortable and competent. Key concept: during the administration of any exercise test involving exertion, cardiovascular or muscular endurance and or strength tests, trainers must always be aware of identifiable signs or symptoms that merit immediate test termination and possible referral to a qualified healthcare professional. These signs and symptoms include onset of angina, chest pain, or angina-like symptoms, significant drop greater than 10 mmHg in systolic blood pressure despite an increase in exercise intensity, excessive rise in blood pressure, systolic reaches greater than 250 mmHg, or diastolic blood pressure reaches greater than 115 mmHg, excess fatigue, shortness of breath, or wheezing. This does not include heavy breathing due to intense exercise. Signs of poor perfusion, lightheadedness, pallor, which is pale skin, cyanosis, which is bluish coloration, especially around the mouth, nausea or cold and clammy skin, increased nervous system symptoms, e.g. ataxia, dizziness, confusion or syncope, leg cramping or claudation. Subject requests to stop physical or verbal manifestations of severe fatigue, failure of testing equipment. Some of the information that explains some of these terms I'm going to read out of the glossary. Syncope is a transient state of unconsciousness during which a person collapses to the floor as a result of lack of oxygen to the brain, commonly known as fainting. Claudation means cramp-like pains in the calves caused by poor circulation of the blood to the leg muscles, frequently associated with peripheral vascular disease. Ataxia means failure of muscular coordination, irregularity of muscular action. And because these are highlighted, I will read the definitions, even though I kind of understand them. Cyanosis, a bluish discoloration, especially of the skin and mucous membranes, due to reduced hemoglobin in the blood. Hemoglobin is a protein that carries oxygen, and perfusion is I believe it's sweating. Perfusion is in bold, but it is not in the glossary. Okay, so I took a while to read all that, so I'm just going to reread these symptoms for immediate test termination. Onset of angina, chest pain, or angina-like symptoms. That was one I forgot. I do apologize. All right. Angina. A common symptom of coronary artery disease characterized by chest pain, tightness, or radiating pain resulting from a lack of blood flow to the heart muscle. Okay, so immediately terminate any of these tests if the client has onset of angina, chest pain, or angina-like symptoms, significant drop in systolic blood pressure. Significant drop would be anything greater than 10 mmHg, even though the exercise intensity is increasing, excessive rise in blood pressure, systolic blood pressure reaches greater than 250 mmHg, or diastolic blood pressure reaches greater than 115 mmHg. Excess fatigue, shortness of breath, or wheezing that does not include heavy breathing due to intense exercise. Signs of poor perfusion, which is sweating. Lightheadedness, pallor, which is pale skin. Cyanosis, bluish, which is bluish coloration, especially around the mouth. Nausea or cold and clammy skin. Increased nervous system symptoms. Ataxia, dizziness, confusion, or syncope. Leg cramping or claudation. Subject requests to stop. Physical or verbal manifestations of severe fatigue. Failure of testing equipment. All right. Anthropometric measurements and body composition. This section addresses key anthropometric measurements of body shape and size, as well as the assessment of body composition. There are many methods for assessing body composition, though some prove to be impractical in a fitness setting given the expense and expertise needed to operate the equipment, e.g. hydrostatic weighing, air displacement, plethysmography, e.g. bod-pod, valid bioelectrical impedance analysis, and dual energy X-ray absorptiometry, or the DEXA. One of the most widely used methods incorporates skin fold measurements to determine body composition via the measurement of select subcutaneous adipose tissue sites. Given the ease of administration and low costs, skin fold measurements are still considered the most practical assessment tool for measuring body composition in the fitness setting. While some skin fold protocols demonstrate similar accuracy to the more expensive techniques, the margin of error increases when the trainers are unfamiliar with identifying exact skin fold locations or lack experience or technique in correctly grasping the skin fold site. Considering how critical a body composition score can be to a client's psyche and motivational levels, it is extremely important that trainers demonstrate strong skills and reliability when assessing body composition. Anthropometric measures include measurements of height, weight, and/or circumference to assess body size or dimension. They are very easy to administer and require minimal equipment. Two examples of this approach are body mass index and waist-to-hip ratio. While these measurements demonstrate strong correlations to healthy morbidity and mortality, they provide only estimations of body composition and fitness level. The personal trainer must consider his or her own skill level, protocol accuracy, and equipment availability, as well as the client's personal concerns when determining the appropriate testing method to assess body composition and body shape or size. Trainers may also opt to use more than one method, e.g. skin fold, BMI, and waist circumference. Table 8, TAC 1 presents a list of various techniques available within the health and fitness centers. Body composition and body size measurement techniques. The techniques for measuring body composition are bioelectrical impedance, DEXA scans, hydrostatic weighing or underwater weighing, near-infrared interactance, skin fold measurements, and whole body air displacement plethysmography. Techniques for measuring body size are body mass index, girth measurements including waist-to-hip ratio, height, and weight. Key concept. Body composition refers to the proportion of lean body tissue to body fat tissue. Lean body mass, LBM, is composed of muscles, connective tissue, bones, blood, nervous tissue, skin, and organs. For the most part, lean mass is metabolically active tissue that allows the body to perform work. A certain amount of body fat is necessary for insulation and thermoregulation, hormone production, cushioning of vital organs, and maintenance of certain body functions. For men, essential body fat is between 2 and 5%. For women, it is between 10 and 13%. The remainder of body fat is stored throughout the body in adipose tissue, either subcutaneously or viscerally, acting as a readily available source of energy or to cushion and protect vital organs. Just as lean tissue contributes to athletic performance, an appropriate percentage of body fat can also be related to successful athletic performance. The calculation of desired body weight based on appropriate body composition is presented on page 206. A certain amount of body fat is necessary for overall health and well-being. Though too much body fat can be detrimental to health and increases the risk of many diseases, ranging from heart disease to osteoarthritis, a person's health can also be compromised if his or her body fat percentage drops below recommended levels. Almost 50% of individuals who join a fitness center cite weight management as a top reason for their membership. Many clients are likely to be concerned with body composition and will have a desire to decrease their body fat in an effort to look fit and trim. When working with clients who are concerned with weight loss, it is important to focus primarily on fat loss without sacrificing lean muscle tissue. The same holds true when working with clients who are interested in weight gain. Most desire to gain lean muscle tissue and not an excess amount of adipose tissue. Others may wish to decrease their body fat for health reasons. Excess body fat has been linked to coronary artery disease, metabolic syndrome, diabetes, certain types of cancer, breast, colon, and endometrial, osteoarthritis, low back dysfunction, sleep apnea, and even premature death. Measurement of lean and fat tissue. It is important to differentiate between overweight and overfat. Overweight is defined as an upward deviation in body weight based on the subject's height. Most normative data defines overweight as 20% or more above ideal weight. Since only height and weight are factored into the equation, excess body weight could be attributed to either fat mass or lean tissue. Overfat, a more accurate depiction of body composition, indicates an excess amount of body fat. Assessment of body composition is often of great interest to a client. In fact, many clients are compelled to enroll in a personal training program for the sole purpose of changing their body composition. The assessments presented in Table 8 Tac 2 are used to assess body composition. Due to the cost and limited availability of the equipment needed, not all are practical in a fitness setting. The assessment of body composition can be quite invasive. It is important for personal trainers to conduct these assessments in a private area and to put the client at ease. Clients should be instructed on appropriate attire to promote easy access to measurement sites. The trainer should act as a professional and be competent in the chosen method. Testing accuracy is improved by proper hydration, so it is important to instruct the client not to exercise prior to testing and to maintain adequate hydration throughout the day. During subsequent reassessments, body composition will likely change due to a loss of body fat and an increase in lean tissue. Between measurements, a client may notice changes in the way his or her clothes fit. These subjective observations will be motivating to the client. Objective reassessments of body composition will be especially important for a client who has not noticed any significant change on the bathroom scale. Clients may need to be reminded that as lean mass increases and body fat decreases, the scale cannot differentiate between the two. Contraindications. If a client is extremely obese, some of the body composition techniques will not be accurate. See Table 8 Tac 2. In some cases, it may be more appropriate to utilize only BMI and girth measurements. Table 8 Tac 2. Body composition assessments. Method: Bioelectrical impedance analysis, or BIA. It is whole body BIA machines are found primarily in laboratory settings. Less sophisticated BIA machines are found in fitness settings. Description: Bioelectrical impedance analysis measures electrical signals as they pass through fat, lean mass, and water in the body. In essence, this method assesses leanness, but calculations can be made based on this information. BIA accuracy is based primarily on the sophistication of the machine and the validity of the prediction algorithms. Many fitness centers utilize bioelectrical impedance analysis due to the simplicity of use. Optimal hydration is necessary for accurate results. Air displacement plethysmography, ADP. Example, BOD-POD or P-POD for children. Marketed for the fitness setting, but it is cost prohibitive for most facilities. The BOD-POD is an egg-shaped chamber that measures the amount of air that is displaced when a person sits in the machine. 2 valves are needed to determine body fat, air displacement and body weight. Air displacement plethysmography has a high accuracy rate, but the equipment is expensive. Dual energy X-ray absorptiometry. Dual energy X-ray absorptiometry, or DEXA. Typically found in clinical settings, it may be found in exercise physiology departments at colleges and universities. Dual energy X-ray absorptiometry ranks among the most accurate and precise methods. DEXA is a whole body scanning system that delivers a low dose X-ray that reads bone and soft tissue mass. DEXA has the ability to identify regional body fat distribution. Hydrostatic weighing, i.e. underwater weighing. The gold standard. Many methods of body fat assessment are based on calculations derived from hydrostatic weighing. Hydrostatic weighing may be found in exercise physiology departments at colleges and universities. This method measures the amount of water a person displaces when completely submerged, thereby indirectly measuring body fat via body density. It is generally not practical in a fitness center setting due to the size of the apparatus and the complexity of the technique required for accurate measurements, which involves the individual going down to the bottom of a tank, exhaling air from all the lungs, expiratory reserve volume, and then holding the breath while the scale settles and records an accurate weight. The assessment must be then repeated to ensure reliability. MRI, magnetic resonance imaging, found in hospitals and diagnostic centers. MRI uses magnetic fields to assess how much fat a person has and where it is deposited. Since MRIs are located in clinical settings, using an MRI solely for calculation of body fat is not practical. Near-infrared interactance, NIR. Example, Futrex. Near-infrared interactance uses a fiber optic probe connected to a digital analyzer that indirectly measures tissue composition, fat, and water. Typically, the biceps are the assessment site. Calculations are then plugged into an equation that includes height, weight, frame of size, and level of activity. This method is relatively inexpensive and fast, but generally not as accurate as other techniques. Skin fold measurement, very commonly used in fitness settings. Skin fold calipers are used to pinch a fold of skin and fat. Several sites on the body are typically measured. The measurements are plugged into an equation that calculates body fat percentage. Total body electrical conductivity, or TUBEC, found in clinical and research settings. Total body electrical conductivity uses an electromagnetic force field to assess relative body fat. Much like the MRI, it is impractical and too expensive for fitness testing. It is important to note that these body composition assessment techniques are not accurate when used with obese clients.